Okay, today we are going to discuss about the prototype drug of fluoroquinolones, that is ciprofloxacin. Okay, for the sake of theory purpose, we have to also write the classification, right? For classification of fluoroquinolones, I will tell a trick. This is very easy to remember. Okay, first, initially the fluoroquinolones are divided into two subclasses. Those are first generation and second generation. Okay, gen, I'm writing gen. First generation and second generation. Now remember like this. Here keep L, M, here N, O, P. Okay, just write L, M, N, O, P. And for here keep L square. Now if you are writing square, it's two times, right? So we'll write lomifloxacin and levofloxacin, and here moxifloxacin, and here norfloxacin, floxacin, ofloxacin, and pfloxacin. And the prototype drug which we should not never forget, that is the first ciprofloxacin. Okay, this is very important. This is a prototype drug and we are now going to discuss about this only. And if you want to remember more, you can also remember here gemifloxacin. Okay, this is about the classification and easy way to remember this. Okay, keep L square, lomifloxacin, levofloxacin, M for moxifloxacin, N for norfloxacin, O for ofloxacin, P for pfloxacin, and the prototype ciprofloxacin. Okay, then we are going to discuss about ciprofloxacin, right? For the ciprofloxacin, first I will tell about how normal bacterial replication occur. Okay, actually why ciprofloxacin is used? It is used as bactericidal, right? For any bacterial infections. Okay, first we'll go with the normal mechanism how replication occurs. Okay, if this is a bacteria, it's nucleus, and this is in the division state. Okay, this is in the division state. Okay, what happens in the initial step of DNA replication? There will be unwinding of DNA, right? There will be unwinding of DNA. While unwinding, see, if we take a spring, any spring like structure, and we try to unwind it, there is stress, right? Means it is tending to recoil. So that stress is also there here. That is called horizontal stress. Okay, horizontal or torsional stress. Okay, that stress should be removed, because if we remove that stress, the DNA replication will go smoothly. Okay, that is done by a protein known as DNA gyrase. Okay, this DNA gyrase removes that stress. Okay, the so the DNA replication goes smoothly. Then, not replication, the unwinding. Okay, then what happens? The next step, after forming the two DNA strands. Okay, after forming the two DNA strands, this daughter DNA strands are separated from each other by another enzyme known as topoisomerase 4. This topoisomerase 4 separates two daughter DNA molecules, and this torsion or stress is removed by the DNA gyrase. Okay, now very simple, the ciprofloxacin in gram negative bacteria will inhibit this step. The ciprofloxacin in gram positive bacteria will inhibit this. Okay, in the gram negative bacteria, the ciprofloxacin will inhibit this DNA gyrase. most importantly the DNA gyrase, and in the gram positive bacteria the topoisomerase 4 most importantly in gram positive bacteria is inhibited. So eventually what happened, eventually the bacteria dies. Ciprofloxacin is bactericidal. Okay, if DNA replication is stopped, why the bacteria dies? See, DNA gyrase and topoisomerase, apart from DNA or sorry, what cell replication, cell multiplication, it also helps in DNA maintenance. So if maintenance is removed, protein synthesis is also gone. So protein synthesis is gone, the bacteria initially dies due to loss of important essential proteins. So like that, the ciprofloxacin is bactericidal. Bactericidal. Okay. Now we'll know about the uses of ciprofloxacin and the adverse effects and the contraindications, and those two I will tell in a very simple manner so that you will remember for sure. Okay. Think of this: in the patients who are using ciprofloxacin, the gut will have BP. In the patients who are using ciprofloxacin, the gut will have BP, and these are the uses. Okay, how? Let's see. G for GIT, U for UTI, T for typhoid, and P for pseudomonas infections, and B for bone and soft tissue infections. Okay. For example, in GIT, emetic bacteria, diarrhegenic bacteria are there. In UTI, like E. coli are there. In typhoid, Salmonella typhi is there. In bone and soft tissue, Staphylococcus is there, which cause osteomyelitis. Then in pseudomonas it cause ventilator acquired infections, and what pneumonia also it cause pneumonia. Okay, apart from this, think like this. Okay, in the human body where all the bacteria infects, like some more examples. Okay, you can write this through the what mnemonic, but apart from this, if you think generally, you can get many more also, like bacteria infect the respiratory, like H influenza, then Mycobacterium tuberculosis. Okay, even though ciprofloxacin is very less active in Mycobacterium tuberculosis, okay, it can act, but it's not that effective. Then like chanceroid. See, if chanceroid is nothing but if these are genital organs, there will be like mass-like formation here. That is nothing but chanceroid. You can search the image and you will get a better clarity about it. Okay, chanceroid. And some sexually transmitted diseases, for example through the species of Klebsiella. Then most commonly seen, that is conjunctivitis. The eye will become red in it. Then conjunctivitis here. Okay, you can take these many examples for the uses. Then coming to the adverse effects. Okay, remember this mnemonic, that is PANT, and after P, what is the alphabet after P? It is Q, and C, keep a C here, CAT, cat. Okay, this mnemonic is somewhat weird, but if you practice this mnemonic, it will be very easy and you will remember everything. Okay, let's come from the bottom. For T, it is tendinitis. Okay, what actually is this? If I explain what whole mechanism behind it, you will remember it very keenly so that you will never forget. Okay, see, these are the collagen fibers. What happens in the patients taking ciprofloxacin? The synthesis of the collagen is decreased and the degradation of collagen is increased. So what happens? The wear and tear of tendons will increase. For example, the Achilles tendon in the lower part of the leg, we can see it will be broken more commonly. Okay, the first adverse effect is the tendinitis, which might or may occur in Achilles tendon. Okay, first one is tendinitis. Then C for CNS effects. What are the CNS effects? Okay, before understanding CNS effects, I will tell one more concept. See, why we are not always restless, why we are not always depressed, why we are not always anxiety, why we are not having anxiety every time, because there is a system called GABAergic system. What this GABAergic system does is it prevents the excessive neuronal firing, it prevents the excessive neurotransmitter or neuronal transmission from neuron to neuron. So that we are not getting depression, we are not getting anxiety, we are not having insomnia, and we are not having any CNS related symptoms. So what is this? GABA is like a gatekeeper, it's preventing the excessive firing of neurons. So what happens in the ciprofloxacin taking patients, this GABA system will be partially what, okay, to an extent it will be stopped. That is, this GABA neurons neurotransmitter will be passed very less. So the GABA related symptoms will increase. What are the GABA related symptoms? Those are, see, actually here the GABA system is working less, not more, it's working less. What happens? The patient fall into depression, the patient fall into depression, the patient go into anxiety, the patient go into insomnia, which is the patient can't get sleep fastly. Then restlessness will be more. Okay, confusions. Okay, these all will be there in CNS related symptoms. Then neuropathy. N for neuropathy. What happens in neuropathy is the neurons will be degraded. The neurons will be degraded. So the patient will have tingling sensation. The patient will complain of tingling sensation. That will point towards neuropathy, which is because the neurons are getting damaged. This is also called most what? If you take most probable name, it is peripheral neuropathy. Okay. Then okay, we finished T, we finished C, we finished A. Sorry, N and A. In the A, it is orthopathy. In orthopathy, see, if these are the joint, if this is the joint, there is cartilage right here. In the cartilage also there is collagen. If collagen is, we discussed that collagen synthesis is decreased and degradation is increased, so this cartilage damage also will be there. So think if it happens in the developing children or in a pregnant woman, the fetus may be also affected, and in developing children there might be very much infection or chronic inflammation also sometimes. Okay, that is orthopathy. Now we know about this, why it happened. Okay, orthopathy. Then Q for QT interval prolongation. Q for QT interval prolongation. Okay, what happens if QT interval is prolonged? Okay, but see, why actually QT interval is prolonged? See, there are ion channels in the cardiac membrane. These ion channels are interrupted. These ion channels which regulate the contraction are interrupted. So there is a prolongation of QT interval. So the repolarization of heart is what? Decreased. The repolarization of the heart is increased. The time of repolarization is increased. So there is prolongation of QT interval. Okay. What happens if QT interval is prolonged? If QT interval is prolonged, there is a condition occurring. It is called Torsades de Pointes. Okay. In this condition, there will be palpitations and excessive contractions of the ventricles, excessive irregular contractions of the ventricles in this Torsades de Pointes, which is occurring through the QT interval prolongation. And we know the mechanism why QT interval is prolonged. And then we finished our Q. And for P, we'll discuss about the P. See, this is the body, and here is our drug, that is ciprofloxacin. When the UV light is contacting our skin, UV light. This ciprofloxacin drug absorbs the UV energy. This absorbs the UV energy and it produces free radicals and reactive oxygen species. And this will lead to the inflammation of the skin, urticaria, redness, itching of the skin, and that is known as photosensitivity. And that is what our P indicates, photosensitivity. Okay, we finished everything, adverse drug reactions, and now you might be able to tell what are the contraindications. Obviously, the contraindications are pregnant women. Contraindications, last contraindications, the pregnant women, adolescent and young children also. And the patients who are suffering from knee problems, we should avoid them. And most probably these are the adverse effects. Then just a small recap, the uses. Okay, we'll have the small recap of uses and ADRs. What is our code for uses? It is gut is having BP, GAT infections, UTI infections, typhoid fever, bone and soft tissue infections, pneumococcal infections. This is pneumonia, and then respiratory tract infections like TB, then H influenza. Okay, causative organism, Mycobacterium tuberculosis and H influenza, then chanceroid, and then conjunctivitis. Okay, most probably these are the infections. Then okay, till here we have the code. Gut is having BP, but these are very general one, respiratory TB, like that we can remember where all the bacteria infects. Then coming to the ADRs, pant, after P, Q, CAT. Okay, Q for QT interval prolongation, which leads to torsedis, D pointes, and P for photosensitivity, and A for arthropathy, and N for peripheral neuropathy, and then T for tendinitis. Okay, mostly these are the adverse drug reactions, and contraindications we can see those are in pregnancy, growing children, okay, adolescent. Dosage vary vastly according to the patient factors, according to the what level of infection, severity of infection. It will vary so much. According to the infection also it will vary. So it will be different in typhoid, it will be different in respiratory tract infection, it will be different in what urinary tract infections, it will be different in gastrointestinal infections. So mostly it is 500 mg twice daily to 750 mg twice daily. Okay, BD. It will mostly in between the range of this 500 mg BD to 750 mg BD, that is twice daily. So how many days we have to continue this therapy also, what according to the patient factors, according to the severity will be there. Okay, thank you.